I'm here to do my podcast today in the short stay unit for older people, and I'm really pleased to be able to introduce to you Dr. Anne-Louise Schocker, who is one of our consultants specialising in this area. And I'm going to be really asking Dr. Schocker, can you explain what this unit's all about and the benefits for the people of Stockport and High Peak?
Thank you, Anne. I'm delighted to be working as part of the team on the unit. And the principles behind the unit are, with advances in healthcare, people are living longer, which is great. But for some of us, that means living with long-term conditions. And people, particularly with long-term conditions who are older and frailer, if they become poorly with what for us would be a minor illness, that can be enough to make them weaker and fall over or become unable to look after themselves whilst they're unwell. And that often ends up in an admission through our emergency department in hospital wards. So the principle and ethos of the team and the unit is to try and rapidly assess these frail older patients, deliver the medical and nursing interventions they need, intensive physio and occupational therapy straight away, and then to work really closely with our social care colleagues and community teams so people leave hospital quickly but with the right support and additional help at home or rehabilitation. And that leads to better outcome for patients and a reduced hospital admission stay. So better outcomes for the patient and for the hospital.
And looking around the unit, a lot of the patients have their families with them. Is that part of the ethos?
It's absolutely to encourage families. It helps patient well-being and prevents patients becoming lonely and isolated. But families are often integral, particularly people with additional needs. It can help improve, for example, an older person's dietary intake whilst they're in hospital. They can be encouraged to eat and drink and promote that side of independence as well.
Well, that's wonderful, thank you very much, and really pleased to have you as part of the team.
My pleasure, thank you.
Well, thank you very much to Dr. Anne-Louise Schocker for that. I'm still on the unit, and I want to talk now about a few other things that have been happening within and around the Trust. And you've heard me talk before about the accident and emergency situation, which unfortunately continues to be a significant challenge. And here we are in the frail elderly unit, and it is often frail elderly people, most recently with respiratory conditions, that have been coming in high numbers with significant need for care. So we're hopefully seeing the end of that, and patients are more able to be cared for in the community and in their own homes, but it does remain a challenge, and I want to thank all of the staff and our partners in social care and primary care for helping with this. The aim, as ever, is to always get patients back into their homes and looked after in the community as early as possible. In terms of moving forward, we've had a meeting very recently with our regulator monitor, also involving NHS England and the Trust Development Agency, where together with our clinical commissioning group colleagues and our local authority social care colleagues, we talked about what we can learn about what happened during the winter months, what we did well, what we perhaps could have done better, to ensure that we can actually move forward even more positively caring for our patients. It wasn't just accident and emergency, but because of the high numbers of emergency care patients, we've also had difficulty with a number of our other patient access targets. The 18-week or referral to treatment target was one of those, the cancer target was another, and we've also had some difficulty with our standard agreed with our local commissioners around information back to GPs within 48 hours of the care of their patients in our hospital. We're obviously working hard to improve in all of those areas, and we have clear, detailed action plans and are looking to implement those as soon as is possible. As you know from previous podcasts, safety is a top priority of this organisation and the staff who work within it. And so we're pleased with the latest results of the summary indicator around hospital mortality and morbidity. This actually measures the number of deaths over a 12-month period against those which would be expected for our community. And so they do look at demography, they look at the types of patients we have living within our catchment area and other issues, and they then measure that against a national baseline of 100. We measure at 90, which is absolutely within our expected range for mortality, but the good news is it's at the very bottom end of that range, and it means that the initiatives that we're undertaking are continuing to work well. We're not, however, complacent, and we're looking to improve still further in delivering the very safest care possible to our patients. The results of the annual staff survey are now out, and in some areas we are showing such things as career progression, effective team working and support for staff by their managers. And those are all to be commended, and we must praise everybody involved. However, there are also areas where we need to do better. Some of them include things like training, particularly around health and safety training. We also understand work pressures are showing as a significant issue, and we must ensure that wherever possible we support staff to try and ensure that anything we can do will stop that feeling of pressure. And that's about staffing, but it's also about support, going back to that support staff feel by their managers. And also there's a need for further better communication between very senior management and the rest of the staff. Now, all of those areas are going to be looked at in significant detail, and we'll be working out with our staff action plans to remedy those areas where we don't do so well and to do even better in the areas that we're doing well on. There's going to be action plans which will be monitored through our normal governance process within the organisation that looks at workforce issues, and I hope therefore that next year we will do even better in those areas because our staff feel empowered and supported. There's two significant initiatives that will hopefully help staff to feel supported and continue to be developed in their posts. One of those is around a health and wellbeing strategy, where we're looking to how we can support staff perhaps through things like exercise, ensuring that wherever possible, maybe they stop smoking, there might be some weight management, and so our strategy encompasses all those areas, and we are supporting staff to help themselves around health and well-being. And one of the other clear areas that we've heard from staff is how do we actually capture the creative, innovative ideas of our 6,000 staff. And so we've come up with an academy system for this organisation, where we're going to develop things like a knowledge bank, an ideas bank, where we can actually harness all those good ideas to make sure that those that actually can fly do fly and create the very best of environments for our staff to be managing patient care optimally. So I'm hoping that those two initiatives alone will help staff feel supported and developed in the work they do on a daily basis. From all of our patient surveys, both the annual survey and our regular surveys that we do in-house, we know how important it is for patients in delivering compassionate care that staff introduce themselves whenever they talk to patients. And so we're really proud to be able to support a fantastic national campaign by Dr. Kate Granger, who herself as a doctor has found out that unfortunately she has got cancer. And in receiving her care, she realised that sometimes she had part of that care delivered without actually having the doctor or the nurse or the therapist saying who they are. So it's my pleasure to be able to support the campaign. Hello, my name is. And so what we're asking all of our staff to do is actually not just support the campaign, but use the campaign to remind us all of the importance of saying our name whenever we greet patients or indeed new colleagues. Thank you.